Good afternoon, everyone. We're just going to, I see there's still people joining us. We're going to give it a few more minutes, but I just wanted to go over some housekeeping for today. Microphones are muted to avoid noise interference. The chat feature of this meeting is turned off. However, you may ask questions by clicking the Q&A button instead of the chat at the bottom of your screen and typing your question. If you're joining us by phone, submit questions to us via email at communications@pmh-mb.ca. Questions unanswered today will be answered directly to you by email after the meeting within 24 hours. This meeting is being recorded and will be available to view on our website for those who were unable to join us today live. The annual report and financial statements are also available on our website at prairiemountainhealth.ca/about us. Okay. Good afternoon. This is our annual general meeting for the fiscal year of 2021-22, and I am going to pass this over to Lon Cullen, the Prairie Mountain Health Board of Directors. Go ahead, Lon.
Good afternoon. I'm Lon Cullen. As was mentioned, I'm chair of the board for Prairie Mountain Health. On behalf of the board, I would like to welcome everyone to our virtual annual general meeting. Before we proceed, I would like to acknowledge that Prairie Mountain Health provides services in facilities and sites located on the original lands and traditional territories of the Cree, Dakota, Ojibwe, Oji-Cree, and homelands of the Red River Métis. PMH respects that the First Nation treaties were made on these territories, and we dedicate ourselves to continued collaboration in partnership with Indigenous populations in the spirit of reconciliation. Prairie Mountain Health currently operates under the direction of 12-member board appointed by the Minister of Health and Seniors Care. I want to acknowledge the other current board members who are Brad Collett, Donna Davidson, Jana Knight, Carla McLean, Judy Swanson, Jody Parsonage, David Morio, Lori Rodich, Wanda Sandy, Wade Schott, and Shep Castra. I would also like to thank Gwen Druell, Dwayne White, and Murray Perot, whose term expired over the course of the past year. Although the board members reside in various communities throughout the health region, they represent the entire region at the board table. The board's mandate and responsibilities arise from the Regional Health Authorities Act. The Act provides the legislative responsibility and authority to plan, manage, deliver, monitor, and evaluate regional health services. The board does this in various ways, including providing sufficient oversight measures and ensuring the organization's accountability by monitoring and evaluating its performance and establishing the 5-year strategic plan. To our executive management team, we sincerely thank you for your leadership, dedication, and commitment over one of the most challenging years that Prairie Mountain Health has ever experienced. To our staff, our local healthcare heroes, there are not enough words to thank you for your contributions every day, especially during the trying and challenging times of the pandemic. Day in, day out, you ensure the best possible care and services provided within Prairie Mountain Health. Your dedication and commitment to providing healthcare in the region is extraordinary. Your compassion is exemplary. Our staff are the heart and soul of Prairie Mountain Health. Never has this been more evident than this past year. To our community partners, thank you for working with us, challenging us, supporting us, and being patient with us, especially through these difficult times. I would like to now introduce Prairie Mountain Health Chief Executive Officer, Brian Schoenberg.
Thank you, Lon. I want to thank the Board of Directors for their support, direction, and commitment over the past year. As we all know, it was another extraordinary year. I'm also sincerely thankful to our staff, physicians, and volunteers for their dedication and commitment over the past 12 months and through to today and beyond. Over the next year, the Prairie Mountain Health Board and the executive management team will continue to advance our regional strategic goals in coordination with our partners, Manitoba Health, Shared Health, and of course, along with all of our stakeholders, including the communities we serve. And on that note, I am very pleased to present our 2021-2022 year in review. Hi, I'm Brian Schoonbart, Chief Executive Officer of Prairie Mountain Health. The past year has been both challenging yet exciting, and the region has had to work really hard to adapt to the ever-changing environment. A few of our executive management team members will join me today to share a few highlights with you.
Of course, many of our challenges this year were related to the COVID-19 pandemic. However, we continue to see our staff step up to face the challenges, think outside the box, and prioritize the best way to deliver care to clients in the new way we were doing business due to COVID. The vaccine clinics in the summer of 2021 were really amazing and showed how quick thinking our staff are. When we were trying to reach out to as many people as possible to administer the vaccine, the staff got creative and we set up clinics at Clear Lake, local beaches, provincial campgrounds, flea markets, and farmers markets. What we started in Prairie Mountain Health spread to other regions and they followed our lead. Staff were so committed to the outreach, they sacrificed their evening or weekends, just a few hours to be there for the clients. In late October, November, when the age eligibility was expanding to ages 5 to 11, the excitement increased again to finally be able to vaccinate this age group. Planning occurred to change the look of the super site to make it a more calming and inviting place for children to have therapy dogs present, eye-catching decorations, and coloring comment cards for children to fill out on what it meant for them to get vaccinated. This wall of their comments was precious and really made our staff appreciate the positive change they were making to these children's lives by getting them vaccinated. It really made you thankful for all that we did. The same creative thinking was highlighted with the mobile clinic team, who continued to find ways to ensure they could safely provide care to clients with the mobile clinic in as many ways possible. For a large part, it was by virtual appointments, but that changed and included more. Maybe it was having to go outside and perform a COVID test if someone presented, or seeing someone to administer a vaccine if it was needed. If the virtual didn't work, then we needed to see them in person. While the mobile clinic may appear big, ensuring these three separate functions could all be done safely and follow all infection control practices and staff could follow PPE protocols, it certainly posed challenge and planning, but the staff did it all because the clients needed it and that was their priority. It's truly amazing how they stepped up to find a way. There was just so many ways teams, individual staff, and the managers met the challenges head on and found creative new ways to deliver care. It made me proud to be part of Prairie Mountain Health and see how staff worked together to come up with ways to still provide care.
Over the last year, there are many examples of acute care teams promptly rising to the challenge of a pressing need. Two such examples are the expansion of dialysis services in the region and the establishment of outpatient respiratory clinics. When we were faced with a lack of dialysis treatment spaces in the region, staff and leadership of the Russell Hemodialysis Program, with the support of the Manitoba Renal Program, stepped up to double their treatment spaces from 12 to 24 spots. This change enabled more people to receive care closer to home. Respiratory clinics were established throughout the region to support assessment and treatment of people in the community infected with the COVID-19 virus. This effective coordination and collaboration of multiple teams, including materials management, dispatch, lab, medical services, and nursing teams to erect these clinics in short order was truly impressive. The clinics, which were located in Brandon, Dauphin, Swan River, Neepawa, and Russell, helped to avoid emergency room visits and provided prompt, effective care to patients, many who took the time to express their gratitude for this much-needed service.
The worldwide COVID-19 pandemic has touched all of us in our personal lives and in our work lives, especially in healthcare. To our staff, I really want to say thank you from the bottom of our hearts, who have really had to step up and be reassigned and take on jobs that you weren't necessarily having to do previously. Working through the pandemic added extra complexity, extra stress, extra effort. And I want to thank you all for providing the care that's necessary for our patients, clients, and residents, and all the care that was needed by our communities. Through teamwork, we remain caring, committed, determined, and resilient. To Team PMH, this has not gone unnoticed. We appreciate and acknowledge the unwavering dedication all of our staff have brought each and every day.
Healthcare within Prairie Mountain Health, provincially, nationally, and internationally, are facing a human resource shortage. Recruitment occurs every day and is a continuous process within Prairie Mountain Health. We focus our recruitment on residents of Western Manitoba. If you are trained in Western Manitoba, our goal is to hire you. We do this by utilizing our Prairie Mountain Health webpage and social media, career fairs, career presentations, student practicums, Home for the Summer program, summer employment opportunities, job shadows, rural internationally educated nurse initiatives, networking with educational institutions, networking with municipalities, advertising, collaborating provincially with the province of Manitoba and other healthcare providers through our overall human resources practices and policies, including workplace health and safety, occupational health and safety, and our workplace wellness initiatives. We provide assistance and support to our existing employees. I would encourage everyone to become involved in our workplace wellness initiatives.
PMH was delighted to be included in the major cornerstone capital projects that were announced earlier this year. Neepawa Health Center, a new hospital with approximately 60 beds, will be constructed. It'll provide a variety of services as it does now. However, we will be adding hemodialysis. The construction is expected to begin soon. The Brandon Regional Health Center will have a new 16-bed intensive care unit, along with 30 additional medical beds, as well as an expansion to the neonatal intensive care unit. Additional exam space will be constructed at the Western Manitoba Cancer Center, and a second linear accelerator will be added. Space for the Center of Hope for counseling and recovery patients to have additional support will also be part of the renovations. At the Dauphin Regional Health Center, a new endoscopy and chemotherapy space will be added, along with 9 additional beds. The endoscopy suite and chemotherapy area will be added to the former temporary ED space. PMH has also been working with Shared Health to have 3 additional smaller renovations. They will be happening in Verdon, Killarney, and Souris Health Centers. These additions will be to remodel their EDs so they can provide better use of their space, improve sight lines, and easier wayfinding. We will be providing some updates on all of those projects throughout the year. Healthcare is everyone's business. We all have a stake in it, and that's why our regional vision is health and wellness for all. We try to engage and communicate with our health stakeholders and our partners as much as possible. And if there are any concerns or compliments, we have a process to receive and follow through on them. We have very many volunteers, volunteer boards, foundations, auxiliaries, services to seniors, and Meals on Wheels program. All work tirelessly to aid us in delivering services across the region. Thank you. Thank you for all the hours that you have contributed. And by the way, our volunteers have contributed over 40,000 hours annually. Thank you for providing your continued support wherever and whenever you can. How fortunate we all are to be backed by proud and caring Manitobans.
We are very fortunate to have so many external partners that we work with, and even more so in the last year during the pandemic. Those partnerships became even more important. One example we had was in downtown Brandon. The partnership we had with Brandon Neighborhood Renewal Corporation, Samaritan House Safe and Warm, City of Brandon, Brandon Police Services, and the Bear Clan, as well as others, had people working side by side with our community programs of public health, primary health care, and the mental health program in downtown Brandon. Everyone was there to protect, help, and serve all of the clients in the community, but in particular to help our vulnerable, marginalized clients that may be houseless at times. This was even more important at a time when they needed to isolate due to COVID or having symptoms of COVID. So many hours of collaboration occurred at all times of the day, evening, and night. Together, it was sometimes to locate where a client was at, figure out where they could go or stay if someone had symptoms or was positive, and how would we get them supplies or food to help them keep isolated. While everyone needs care and someone checking on them, it is just as important and even more so that our houseless, vulnerable clients needed it. Someone was there to meet clients where they were at in their lives, good or bad, and determine what they needed. Taking the opportunity to vaccinate when it worked was important, that we all work together. What we learned with COVID is no one person or system can do it all. It takes a team. The team of Prairie Mountain Health staff and community partners in downtown Brandon truly defined a team, as they all had the same goal and focus, which was about clients and how best could they be helped during this time. We saw this similar partnership with organizations and staff play out in Swan River and in Dauphin with our marginalized vulnerable clients through the Meet Off Main or Under One Roof, respectively, and with Community Health Association Parkland. Our mental health program is so fortunate to have many partners, which ensures collaborative care and acknowledges that PMH staff are not the only ones that we can deliver care. When community opportunities or programs are being planned, the mental health program has reached out to help support partners develop the programs. This may be helping in the development of proposals or consultation on spaces or what all partners can bring forward for staffing or programming to help the services be delivered effectively. Huddle Brandon is the most recent partnership that the mental health program engaged with right from the start of their planning and have supported them in whatever way they could. This commitment from PMH programs to our external partners and their commitment to PMH to keep us all engaged on work is for the betterment of clients. We are so fortunate for these relationships that because they have established together that we can do more than we can independently.
This year, we had a number of things that affected our bottom line financially. Supply chain shortages and inflationary increases significantly impacted the costs of goods and services used by PMH. Staffing shortages that are being experienced across the country also impacted PMH, resulting in vacant positions that were filled using overtime and employment agencies. PMH continued to feel the financial impact of COVID-19 due to the increase in staffing, services, and supplies that was required in order to meet the needs of the community. These COVID-19 related expenses were reimbursed from the province, which allowed us to manage within our existing budget. Also, as part of the health system redesign, a variety of programs and services were transferred between PMH and Shared Health. This did not have an impact on the bottom line as the associated budgets were transferred with the programs. Even though there were a number of items that had a financial impact, PMH ended the year with a balanced budget.
In 21-22, PMH received its National Accreditation designation, the second since 2012. PMH actually achieved 93.1% of the overall quality improvement criteria measures. Wow. We have a little bit more work to do, but we will be submitting that shortly. I want to thank all of the accreditation teams and leaders who worked over the past years to get ready. Accreditation isn't, though, just about an event. It's about a process of us always being prepared for the ever-changing environment and health standards. Over the next year, we will continue to work hard towards a new normal, as the pandemic really has affected everything. And as you know, we're facing staffing challenges throughout our region. But it still makes us focus on what's important, what our strategic goals are, and what our actions are. We will continue to work on those over the years to come. We know we have a challenge ahead, but I also know that Team PMH is ready for any challenges that we face. We remain committed, as we always have, to work towards our vision of health and wellness for all.
Hi, I would like to now introduce Brad Collett, who is the chair of our Finance Committee.
Thanks, Lon. As mentioned, I'm Brad Collett, chair of Prairie Mountain Health's Finance Committee. During this past year, I've been joined on the Finance Committee by Gwen Droll, Jana Knight, and Board Chair Lon Cullen. Unfortunately, Gwen had to leave us, but we're fortunate to have Shep Castra join the committee. We've also recruited a talented community representative in Ian Gerard. This brings the composition of the committee to 5 people, of which 3 are professionally designated accountants. In our meetings, we're also joined by 3 Prairie Mountain Health executive management team members, all 3 of which are professional accountants. We meet at least 10 times a year or more as required, and are charged with providing financial oversight on behalf of the board of directors. While finances for such a large public organization can be daunting, we have an excellent qualified finance staff at Prairie Mountain Health. And during the fiscal year, we hired a new chief financial officer. His name is Dan McGregor. You saw him in the video, and he comes to us from the Winnipeg Regional Health Authority. Dan is extremely well qualified and does a tremendous job leading Prairie Mountain Health's finance team. With that, I'll turn it over to Dan McGregor, Prairie Mountain Health's chief financial officer.
Thanks, Brad. I would like to acknowledge all the time put in by the board members as part of the Finance Committee and appreciate all of their contributions. A summary version of the audited financial statements is included in the annual report, and a complete set can be found on the PMH website, prairiemountainhealth.ca, under the About Us Regional Reports section. The auditor's report confirms that the audited financial statements present fairly the financial position of the region. The auditor's MNP issued an unmodified audit opinion, which means that no significant issues were found during this audit. On the statement of financial position, you will note that the assets have increased from the previous year by approximately $35 million. This is mainly due to funding that is due from Manitoba Health. The liabilities have also increased over the previous period by approximately $30 million, and this is largely comprised of $33 million in salary and payroll deductions payable, offset by a decrease in long-term debt, mainly from paying down loans from the province of Manitoba. The statement of operations shows that revenues were approximately $93 million higher than the initial budget. This is mainly related to reimbursements from the province for COVID-19 related expenses and in-year funding increases from Manitoba Health, largely related to the settling of collective agreements. Expenses were also $92 million higher than the initial budget, which include costs related to COVID-19 and the staffing related expenses from the settling of collective agreements as mentioned earlier. PMH ended the year with an operating surplus of $18,000 and a capital deficit of $5.4 million for a net deficit of $5.44 million. It should be noted that the capital deficit is related to accounting practices that result in a timing difference between the funding received and the amortization of capital assets and not an actual deficit. This chart shows the allocation of expenses between the various programs and services within PMH. I will highlight some of the larger expense areas. The large blue area that shows 40% of the costs relate to acute care services. The next largest area, 26%, relates to personal care homes. 17% includes the total for community-based services, including home care, community health, and mental health services. And 6% relates to physician remuneration. This chart shows the various revenue sources for PMH. 87% of the funding is from the provincial government, Department of Health. 5% of the funding is from the province of Manitoba's newly formed Department of Mental Health, Wellness and Recovery. 5% of the funding is from residential charges. And the other revenue includes items such as ancillary and interest income. And that completes the summary of financial activities for 21-22. And with that, I will turn it back over to Lon.
Thanks very much, Dan. This brings us to the end of our scheduled presentation, and it's now time for a question and answer session. We will have approximately half an hour to conclude this session, and if there are no questions, we will end early. Turning it over to the moderator now, please.
Thank you, Lon. As a reminder to everyone, to ask a question, please click on the Q&A button at the bottom of your screen and type in your question there. If you wish to ask your question privately or don't get a chance to ask it before our time ends today, please email us at communications@pmh-mb.ca and your question will be directly responded to you. Brian, I'll pass it over to you now for an opening statement. Brian, I'm just going to ask you to unmute. Sorry.
Sorry, just a second. So we've received a number of questions related to the validity of the COVID-19 vaccines. So the pandemic has challenged not only us here in Manitoba, but it's definitely affected everyone throughout Canada and the world. So our Manitoba experts have been collaborating with many organizations, including the National Advisory Committee on Immunization, and of course with Health Canada. We here in PMH support what the government and science is showing us. So today we'll be discussing and reporting on the outcomes of Prairie Mountain's health operations and financial statements over the 21-22 fiscal year. To those of you who have submitted some questions around the topic of vaccines, we thank you for your inquiries and we will respond to you directly. I just want to remind you that there are excellent sources, both on the Health Canada website, but also on Shared Health website, and many sources available of information related to the vaccines. So thank you very much, and I'll turn it back to the moderator.
Thank you, Brian. Our first question, I believe Dan will be able to answer. We have a question from Karen, and how much was spent on private agency nurses in the 2021-2022 fiscal year?
So I have the number here. It's maybe it's not just nurses alone, but includes healthcare aides as well that we contract with nursing and healthcare agencies. The number we had was $23.1 million we spent in 21-22.
Perfect. Thank you. And the next question we have is, how are recruitment efforts going for nurses in the region? And I guess we can talk about all recruitment. Brian, would you like to take this one?
Absolutely. So we, like the rest of Canada and much of the world actually, are experiencing significant difficulties recruiting. We are constantly recruiting and we're constantly achieving results in that recruitment. The issues is that it's difficult to keep up to the number of folks retiring. What I can say is that we've been working very hard, as was mentioned in the video, in trying to attract nurses, particularly from the area. We've been working with the educational institutions to actually have more seats, nursing seats specifically out in this area. So we think that this will make a difference. We have, of course, the program in Verdun, and there's one coming up in Nipawa as well, in addition to what's already existing out here in PMH. So we're excited about that the new seats are being offered for nursing, and we hope that that does make a difference.
Thank you. Another question here is regarding home care. Will further resources be available to that program? I note that the finances show the community services portfolio as a lesser expense, where we know that needs are higher. Sorry.
Okay.
Brian?
Yeah, certainly I can speak to that. So I know that there has been planning where the government is hoping to introduce at some point, and I don't want to steal any thunder, but that there are going to be additional programs for seniors that will help them to be able to safely stay in their homes, and much broader than what currently home care is offering. So they're looking at potentially having, for example, where based on the need of the particular individual, they would be given an assessment of dollars to help them in their supports. Likewise, they're also looking at how they can support seniors to attend or be part of some of the supportive housing that exists or that may exist into the future. So we're looking actually, or they are looking at preparing those two opportunities for seniors. So I would keep my ear open to those opportunities that hopefully will be announced within the months to come.
Thank you. So more along this lines, I guess, with recruitment and everything, what is PMH doing to help support existing staff to prevent burnout while helping to keep positions filled?
That's a very good question. So I think the major thing to help the staff with burnout is, first of all, trying to recruit staff. So we know we're trying to do that. If necessary, too, we've been having to ask the staff to do a lot of overtime. And this past summer, we've actually had to close some sites temporarily or reduce some of the services. That was to also help with the staff not feeling like they had to pick up shifts when we know they had already met their maximum. But there are a number of initiatives that are being planned, even provincially, regarding this. We're even looking at potentially some financial incentives. And I know really money isn't going to make the difference because we're all very tired based on what we've been through the last few years. But we're looking at more supports for the staff, psychosocial supports, looking at what we can provide the staff in terms of resources that are available to them that maybe haven't been available in the future. So there's a number of initiatives on the go. And we too, here in PMH, will be working more specifically on some projects, wellness projects, on how we can boost the morale in PMH.
Thank you, Brian. And one other question here we have is, we're running food security programs such as Community Breakfast Club Monday to Friday, evening meals Monday to Saturday. And this is, sorry, I missed one line here. This is an accessibility program in Dauphin called Under One Roof, but we do have other ones such as the 7th Street Health Access Center in Brandon. We need help staffing our evening programming with qualified mental wellness advocates. How do we go about working with Prairie Mountain Health to make this happen?
Well, that's a very specific question, but I'd say I would encourage you to reach out to the individuals in those communities to help. I think it is important that we do work with our stakeholders in this regard. We do know too that mental health and addictions is even more severe issue than we were facing even a few years ago. So I would encourage us of this particular group to reach out and see how we might be able to partner to be able to have those resources available in the time slots that I think you're thinking.
Thanks, Brian. One that just came in. Is Prairie Mountain Health planning or supportive of expanding prevention services to keep acute emergency and outpatient services from being stretched?
Well, that's a very good question. And actually the answer is an obvious yes. I mean, we have to eventually shift more from away from what I call the remedial services in acute care, if we can provide more services in the community and before they need the acute services, that's really what's going to make the difference. That takes a long time, but we have over the past year, even in the terms of mental health services and the such, is really where we are trying to focus more on touching people where they are in the community and making a difference there. I think that provincially though and nationally, we all recognize that it's difficult to sustain everything that we're doing in acute care. And really the only way that we can try to master the amount being spent on acute care services is really to start at the front end.
Great, thank you. Sorry, so again with recruitment and retention, in regards to staff shortages and emergency room closures, has any thought been given to EMS staff shortages and what can be done for them?
So I don't know if actually our community folks know, or they should, but actually the EMS services were transferred to shared health. So it's no longer under PMH services. However, I do know, just because we partner with shared health, that they are looking at initiatives that would indeed try to increase the number of staff in that area. And we all know that EMS is experiencing the same staff shortages than the rest of the health industry, or all industries. And with us having to reduce services because of our physician and nursing shortages and other shortages, it's even putting more of a strife on EMS. So I just want to say that I do know they're working hard on that. It is very important. With a strain on the whole system, it's affecting each other, and so collaboratively is how we have to respond. I do know they have some very specific initiatives, and they're hoping that some of these are shorter term. So I really applaud for them for their work that they're doing on this right now. Hopefully we'll see something in the months to come.
Okay, thanks, Brian. So here's a question then. What is the difference between Shared Health and Prairie Mountain Health and their mandates?
Okay. Well, Shared Health was a provincial organization that was established to really look after those programs and services that are provincial in nature. In other words, that don't necessarily affect one SDO. And when I say SDO, PMH is an SDO, Service Delivery Organization. So Shared Health is looking after Health Sciences Center, which is a provincial hospital. It has the most acute services provided within Manitoba, but it's also looking after shared services, which, like for diagnostic imaging, it's a shared service that each of us, they are in our regions, but they are still part of Shared Health. The same is with EMS. There's also information technology, but there's even others that will be more part of the shared services, including capital planning and HR. There will be some other parts that what we call back office functions that will be more held in Shared Health. The major role, though, that Shared Health plays is in the coordination, and not writing them themselves, but in the coordination of all SDOs and government in the development of the clinical and preventative services plan. So their job is to coordinate us to develop this provincial plan in which we would all align to in terms of our clinical services. So whereas PMH is like one of the other rural or even WRHA, where we are providing the services directly to the residents of our community. I hope that provides a bit of an explanation, but if you can remember anything about what I just mentioned, it really is about that Shared Health deals with the provincial issues clinical issues and back office issues or services in the province.
Thank you. So we have another question here. Did Prairie Mountain Health contribute to the health facility in Ashern? It's included in the report. However, Ashern is in the Interlake Regional Health Authority, Interlake Eastern.
So that's a good question. No, that wasn't part of our plan. Obviously, Ashern is Interlake, but there were a number of projects announced as part of the Clinical and Preventative Services Plan. In the video, it was shown that, for example, Dauphin, Neepawa, Brandon, the Western Manitoba Cancer Center, they were announced as keystone projects in the Clinical and Preventative Services Plan. Ashern would have also been mentioned in that plan, but they would have been a part of another region. But the overall capital plan for CPSP, it affected almost all regions, which was good. It was an announcement of what capital projects were needed based on that Clinical Preventative Services Plan.
Thank you. How is Prairie Mountain Health working with the unions to help with contracts in which my opinion could help with recruiting?
So as you know, there was a delay in it seemed there was an alignment so that all the contracts needed to be settled at one time. I think most of the contracts are now settled other than for MAHCP. So obviously, I agree that the settlement of the contracts did help us and will help us with the settlement of those. I know even though that many have been settled, unlike MNU, they haven't yet had their payout of the new salary nor the retro that's owing to them. So we hope that that's going to be done before year end. And of course, in terms of the one union that's still outstanding, it might take a while by the time they're finished settling to the payout of their amounts. But I agree, we all are trying to work together to get these settled and the payouts made as soon as possible, because it does affect our recruitment abilities.
Thank you. Another question here. Sorry, they're just coming in. I'm trying to read. Is any investment or change in procedure planned to facilitate better scheduling of staff to make the best use of our limited resources?
So actually, that's a very good question. And I think that scheduling is a big piece of what is required in PMH. And, you know, with 7,500 staff and the number of sites that they could be working at, it's a big job. So I do want to say that we as a region are trying to actually substantially change the way we staff so that there's more around the clock services available, but also that there's what we're trying to have is hubs of staffing offices that would deal with certain sites and certain programs and services. Also, the one change we have made is because we've had to rely so much on agency staff, is that we have actually dedicated staff working with the agencies who know those contracts well and also where agency staff might be needed. So we are making significant efforts to actually substantially change the way we staff so it's not so fragmented, and that we have a more coordinated approach, and that we actually have the folks that are scheduling are really quite become quite experts in that area and know who and what areas are requiring staff. So I'm really looking forward. It's not completely rolled out yet, but we're well on our way, and I'm hoping it does indeed make a difference.
Thanks, Brian. Another question here. Will there be any consideration of the addition of an urgent care or ambulatory care center in Brandon? Do you feel more urgent care models in our organization would help with both access and financial or health human resource strains we have in our region?
Well, that's a good question. I don't know if urgent cares are what we need in the larger communities. However, I think we have to work with our primary care providers. So for example, in Brandon, we could work with the clinics, and Dauphin could work with the clinics. You know, some of those, I think there could be arrangements made where there's less of the, I would say, the lower level acuity coming into the OR. They could be directed better to primary care services at the physician's offices. And we can maybe work in partnership to try to accomplish that. Urgent care centers are a slightly lesser version of an emergency department in that they won't necessarily be dealing with resuscitation and such, but still very much needed acute service. So in that case, I see the urgent care maybe being more fully developed in areas where we don't have as many physicians or in smaller communities, still very vital, addressing the majority of our needs. They might have limited hours. And I can see also nurse practitioners being playing a major role in the urgent care centers as well. So actually urgent care and the use of nurse practitioners, other extenders like physician assistants, clinical assistants, all can be part of that model as well in urgent care. So I think the longer term vision was to determine which ones will be urgent care, which ones will be emergent rooms. For emergent rooms, they're expecting us to have 24-hour coverage, dedicated ER coverage, you know, and certain services available. Obviously, for urgent care, that wouldn't be a requirement. We could make them part-time. They wouldn't necessarily have to have a physician on site. So yeah, it's in development, and we really have to look in this new scenario where we have a shortage of physicians at what we can provide in each and every site. And of course, consider the size of the communities, the number of people that we're serving. All of that makes a big difference.
Thank you, Brian. At this point, we don't have any other questions here right now. I think we can pass it on to Lon now, and in closing statements, thank you so much to the panelists, to Dan and Brian for answering the questions. And yeah, we appreciate that. Sorry, I'm just looking at something else here. So Lon, I'll pass over to you.
Okay, thank you very much, everybody, for your involvement today, and thank you for joining us today. Shortly, we'll be able to make the AGM video that you saw here on our YouTube channel and our website for those who wish to see it again or those who missed the meeting today. Thank you very much for your participation, and enjoy your day. Thanks all.